So this is definitely the future, and we will discuss the same thing in the year 2030, and you will say that we have discussed this already.
Yep.
This will happen.
I can see that. I can see that. As a true fan of remedies, I would like to see that, actually.
Me too. And we are working towards it. Just that we are still waiting for the right partners.
Yeah. How has your understanding of healing and getting better and stronger and coming back to your natural vital force changed over the years, especially in the clinical?
It certainly has changed. Hence, we call it medical practice, because you're still practicing. I started practicing homeopathy in the year 2001 when I got my bachelor's degree.
I was first grade in elementary school.
All right. Now you make me feel old.
I know.
Yeah. So, which I am, obviously.
Nah.
So in 2001 is when I finished my bachelor's, and when we are allowed to start practicing homeopathy. After which was 3 years of my master's. So during your master's, you're still practicing homeopathy because you have certain postings in the diverse departments of neurology, of respiratory problems and hepatology and all that, immunology. So in the initial years, my history taking was longer. For example, when I used to sit with the patient, I used to spend a lot of time with the patient trying to understand him, trying to gather information from him. So this used to go on for 45 minutes to 1 year. If you cut to what is happening today after 25 years of my practice, once the patient enters into my clinic, I already start analyzing. And my history taking has gone so much shorter with the experience and with the failures that I've had in the past, which have transformed into more consistent and accurate results. So my history taking has gone from 1 hour to now 10 minutes. Now I'm just asking the right questions. Initially, I used to dabble with several questions, and then pull my hair out to understand which questions are to be asked. And the patient is telling you what you're asking. You will only get a good answer when you're asking a good question. So first, I was asking questions which were around the bush, and now I'm asking straightforward questions. So that understanding has changed over the years. I mean, I started with treating trivial problems like cold, cough, fever, and all that, which has transformed into now treating cases with autism, cases with multiple sclerosis, cases with first stage cancers, autoimmune renal failures, hepatic disorders, so on and so forth. So obviously my level has changed, and my technique has gotten better because I exactly know what to pick from the patient. This has definitely changed. And this will, I hope, keep improving and changing.
Yeah. How homeopathy can help with autism? What results have you seen? All
right. So autism obviously is a psychological problem or a psychiatric problem where the neural networks in your brain are not perfect. It is not that you have a deformity. I mean, you can do hundreds of MRI scans and find nothing in the brain of an autistic kid. But these are neural networks which have not been established properly. So this is exactly what the doctor has to look into. So in the first place, is this acquired or is it inherited? It is still So it is still a very disputed territory, because people do not know whether children are born with autism, or do they have autism inborn, or is it induced. Many times patients, as doctors, I mean, I'm not a research scientist, I'm a doctor, right? So many times people or patients or parents will come to us and say that everything with the child was okay till about 18 months to 24 months. And suddenly, like a snap, everything changed. My child, who was babbling, who was talking, suddenly stopped talking. Then we always ask, okay, what do you think could have led to this particular situation? Then they could give you several examples of drugs or unproven, I'm saying unproven new vaccines that they've taken. Has that led to autism is something that we have to consider. Sometimes we take it into consideration when the patient is telling you directly that after 18 months of my child's birth, we did 1, 2, 3, 4 things, after which these symptoms started coming in. In homeopathy, we have a rubric, or we have one particular indicator that clearly says ailments after vaccination. Not everybody responds to a vaccine in a favorable way. We have seen in the COVID pandemic that not everybody responded to the vaccine in a particular favorable way. People got heart problems, people got their autoimmune problems back. I mean, many pharmaceutical industries or companies have been sued for it. People lost their eyesight, they got heart attacks. I mean, every day I see tens and dozens of people who come to me saying that after the COVID vaccine, they have these problems. So we take that into consideration because the patient is telling you that I never had this problem, and after the vaccine, this thing kicked in. So these factors also have to be looked at. And in homeopathy, it has been mentioned in the repertories that there is a rubric called ailment